Delaware County Department of Human Services Block Grant Public Hearing. This meeting is to discuss the plans that we have in the Department of Human Services for the upcoming fiscal year for the Human Services Block Grant, which funds several departments within the Human Services. You will hear more about that in a few minutes. Next slide, please. We're starting this evening talking about our mission and visions for each of the categorical offices, which are included in the block grant. Prior to doing that, we're going to talk about the overall mission of Human Services. Next slide, please. So Delaware County Human Services is committed to addressing the social service needs of county residents in an inclusive and equitable manner with a holistic, trauma-informed, cultural competent, fiscally responsible approach designed to meet the statutory mandates of the respective program offices. One of the things Human Services did a few years ago was the Unpacking Systemic Racism Project. Out of that, we came up with our racial equity statement. If I have next slide, please. Human Services, our racial equity statement is Delaware County Department of Human Services acknowledges and understands historical and ongoing systemic racism exists in our work environment. Racialized practices and behaviors which result in disparities and inequities within our department will not be allowed to continue and must change. The department's goal is to create an organizational culture of inclusion and equitable success where the unique voices of all are valued, thereby bringing demonstrated diversity and creativity to our workplace and services provided. Next slide, please. I will now hand it over to Janet Dreitlein to introduce herself, and I'm sorry, I should have done that earlier, and talk about adult and family services.
Good evening, everyone. My name is Janet Dreitlein. I am the administrator for the Mental Health, Intellectual and Developmental Disabilities, and Early Intervention departments. I'm standing in a little bit for Jessica Fink, who wasn't able to be here, and we'll be talking right now about Adult and Family Services, which is her department. So the mission of the Adult and Family Services oversees a wide range of community services to families and adults in Delaware County. Responsibilities include oversight of contracted services under the continuum of care for homeless programs, including homeless prevention, emergency shelter, and permanent housing. Adult and Family Services also provides contractual oversight for food assistance programs, medical assistance, transportation, and a variety of other supportive services. Adult and Family Services supports agencies through ongoing education and the provision of tools to ensure equity in their services and assist families and adults in leading safe, healthy, productive lives and break the cycle of homelessness. Families and adults will receive equitable, trauma-informed, and outcome-focused services from provider agencies. Next slide, please. I'm going to now hand it off to Pam.
Hi, everyone. My name is Pam Bell. I'm the Drug and Alcohol Administrator here in Delaware County. The Drug and Alcohol Mission and Vision Statement. The mission of the Delaware County Single County Authority is to assure the provision of a comprehensive array of quality alcohol and other drug services for eligible children and adults that will assist them to maximize their human potential. The Office of Drug and Alcohol, also referred to as the Single County Authority, is an administrative office that oversees the delivery of treatment and prevention services in Delaware County. The Office of Drug and Alcohol Programs provides funding for prevention, intervention, and treatment services to all eligible Delaware County children, adults, and families. And now I will turn it over to Alicia. Next slide, please.
Good evening. My name is Alicia Redden-Ravel. I am the Deputy Administrator for the Office of Intellectual and Developmental Disabilities. Our vision and mission statement: the mission of the Delaware County Office of Intellectual and Developmental Disabilities is to advance the health, welfare, rights, independence, and community inclusion of children and adults with intellectual and developmental disabilities and/or autism spectrum disorder in Delaware County. We envision a community that includes people with intellectual and developmental disabilities and/or autism spectrum disorder as full members of society who self-determine to the greatest extent possible, visualize fulfilling lives, and utilize natural and paid supports as necessary as a part of a meaningful life. And now I'll pass it back to Janet.
Next slide, please. Mental health, the mental health mission and vision statements. Delaware County Department of Human Services Mental Health Office's mission is to ensure the provision of a comprehensive array of quality mental health services and supports for eligible adults and children that will assist participants in maximizing autonomy, independence, and self-determination. We do this by collaborating with as many adults, families, systems, and providers as possible to identify individuals who are in need of mental health services. We strive to educate all our stakeholders and our system partners regarding the need for the delivery of culturally competent, trauma-informed, and evidence-based services. Next slide, please.
So to talk a little bit about the Human Services Block Grant, I want to first give a little bit of background on how the block grant came to fruition. Next slide, please. The block grant was initiated by the state in fiscal year 2012-2013 with Act 80. There were 20 pilot counties allowed initially, when it was initially put forward. Delaware County was one of those pilot counties. What the block grant does is it combines funding for the various human services programs, and that we can utilize the funding as we see fit as a county. The goal is to make the funds meet the needs of your county. The categorical programs that are now included in the block grant are mental health, intellectual and developmental disabilities, drug and alcohol, and adult and family services. As part of this process, we initiated an internal and external planning team. So if I could have the next slide, please. The planning team includes myself, Sandra Garrison, I'm the Chief of Social Services and Community Services for the county, Angelique Hires, who's not here tonight, she is the Human Services Director, Gaston Gonzalez, who is the Chief Financial Officer for Human Services. You've met Ms. Streitline, Donna Holliday, who is the Mental Health Deputy Administrator. You also met Ms. Redden Ravel, Ms. Bell, Jessica Fink, who's the Adult and Family Services Administrator, Vandy Mosery, who's a Fiscal Officer, and Warner Williams, who's a Fiscal Officer. And we also included the Mental Health, Intellectual and Developmental Disabilities, as well as the Drug and Alcohol Advisory Boards. If I could have the next slide, please. This is a list of our stakeholders. I will not read through all of them, but as you can see from this list, we have a variety of programs, outside entities, internal county entities that aren't part of social services or human services, but we work closely with, such as the prison, the district attorney, the public defender's office, and so forth, as well as we have some providers on here and other entities with whom we work for that do have input into the plan, as well as a benefit from the services that are provided. So if I can have the next slide, please. One of the things with the block grant I always like to mention is it allows each county flexibility. Like I said earlier, part of the state's goal in setting up the block grant was that you as a county know what your residents need the most. And the residents of Delaware County may be very different from the needs of the residents of, say, Venango County. So the block grant allows us to take the funding among those various categoricals and shift it as we see fit. Originally, we were only allowed to move 25%, and then now we're allowed to move whatever funds we feel appropriate. However, we cannot get rid of any one categorical. What this has allowed us to do over the years is, when it first came out, we were having issues with this drug and alcohol program. What was happening is we didn't have the funding to keep the services open. So there were various times where we had to say, you know what, we don't have funding to continue county-funded services, and then individuals would come in, we wouldn't be able to serve them, which is a really bad place for us to be. And then on the other hand, we have other programs that would get funding that we would not spend all the dollars, and we'd have to give those dollars back. So the block grant allowed us to move those dollars from some of the other programs where we didn't need them at the moment and shift them to drug and alcohol so we could fund those individuals that we otherwise would not have been able to fund. We also, as we went through this process, the Affordable Care Act came about, which expanded the medical assistance population, so that did free up some of the funding that would have historically been utilized by mental health and drug and alcohol. We were able to support the intellectual and developmental disabilities population, because at that point their population was increasing and the costs were increasing. We've also done stuff with shelters, with rental assistance, and also have done some stuff with with recruitment and retention efforts of not only our staff, but our providers' staff. So if I could have the next slide, please. So looking at our accomplishments in the fiscal year 23-24, which just ended in June, we wanted to kind of go through what we've accomplished last year, and we're going to talk in a few minutes about where we see ourselves as a county going. So if I could have the next slide, please. The overall human services accomplishments, sorry. We have been able to collaborate with executive leadership and quality teams to develop the annual Human Services Integrated Quality Improvement Work Plan. We've also enhanced the partnership with the criminal justice system within the county. As I'm sure people are well aware, individuals often end up in the criminal justice system due to some underlying issue that may be better addressed in the human services world. We've also partnered with community organizations to make sure county residents have equitable access to services. We've continued the Healthy Kids, Healthy Schools initiative that was started by our district attorney's office in the county in conjunction with Human Services, and worked with the school districts to put services in place within the schools to help those students to make sure they're going in the positive direction and are receiving whatever services they may need. We also have service maps for all the human services programs to show individuals how they can enter, what programs are available, what services are available, and also the no wrong door activities have been increased. The no wrong door policy, the idea is that no matter where you enter the system, within all the social services, not just human services, you'll be connected to the programs you need. In an ideal world, and what we eventually hope to get to, is that if someone comes in to say, mental health, but they have a drug and alcohol issue, and maybe they have a child that needs some services through Children Youth Services, and maybe they have an elderly parent that needs to go through the aging services. Instead of going to the various offices, they come in one place, and that person who's working with them that has a warm handoff and says, hey, here's another person that can help you, let me connect you, let me get you those services, so they're not going to various offices, you're only going to one place. So with that, I will turn it back over to Janet to talk a little bit about adult and family services.
Next slide, please.
So the accomplishments for adult and family services in March of 2024, the new outreach team began providing services to the street homeless population with a goal of connecting participants to shelter, mainstream benefits, and stable housing. Funding was secured to reestablish the SOAR program to assist homeless individuals in obtaining their Social Security benefits more expeditiously. A training committee was created of county and community partners to identify and coordinate educational trainings on topics such as drug and alcohol, mental health, veteran services, domestic violence, victim assistance centers, and trafficking. All community partners are welcome to attend. Additional funding was secured to assist with the increased rent assistance needs. Next slide, please. Shelter services have been reinstated
To pre-pandemic capacity. Delaware County Housing Authority provides 25 mainstream vouchers for homeless persons with disabilities verified by the Social Security Administration. Successful application for the Home for Good funds to approve furniture, rent assistance, SEPTA passes, SOAR funding, landlord incentives, and temporary emergency shelter. And I will hand it to Pam.
For our drug and alcohol accomplishments this year, we engaged hospital and emergency room staff, resulting in an increase in the utilization of our single county authority's certified recovery specialist warm handoff program to serve individuals surviving overdoses and/or those with substance use disorders who present to the physical health system. Essential to this increase was successful work with the newly contracted certified recovery specialist warm handoff provider, who serves to expand these services exclusively in 2 of the 5 hospitals that serve Delaware County residents. We also provided technical assistance to existing recovery house providers to increase coordination of care, ensure safety and comfort for their residents, and to professionalize these services despite these not being treatment services but recovery support services. Very similar assistance was also offered to our 2 new providers who are to contract with the SCA to provide funding to their residents living at their state-licensed recovery homes. The Delaware County SCA also co-coordinated and funded 3 social wellness events, which are sober activity events through partnerships with our contracted recovery house providers. The events included a softball tournament, outdoor hike, pet adoption event at Ridley Creek State Park, and a health and wellness fair with county providers present with resources and information for the community. Events were open to the community and families in recovery. With coordination from the SCA, funding from the PA Department of Drug and Alcohol Programs, and facilitation by MVP Recovery, the county also established a drug and alcohol-focused crisis stabilization center. The program, which is called STAR, which stands for Stabilization, Triage, and Referral, is to centralize a pathway to treatment and resources while removing all barriers. The focus of the service enhances the resources to the community members of Delaware County and decreases frustrations one may experience of the fragmented systems within the behavioral health that currently exists. The staff are on site to assist with applications to medical insurance and food stamps. The services will include the ability to provide food and basic hygiene needs, a place to stay, and supports while linkage to treatment is arranged, bridge orders of Suboxone, and in some cases, when appropriate, psychiatric medications, and education support for medical concerns with linkage to primary and/or specialty care needs. We also worked with the Law Enforcement Treatment Initiative Program, which reached their 50th diversionary referral through tracks 1 and 2 of the program. And as of June 2024, there were 156 individuals referred to and admitted into treatment because of this program. LETI is funded by the Single County Authority, coordinated by the District Attorney's Office, and implemented by MVP Recovery. It was reported by the Attorney General's Office that Delaware County is ranked third highest success rate out of 29 counties in the Commonwealth who have adopted LETI. Delaware County's LETI program also has trained over 100 officers in this initiative through multiple different police jurisdictions. The SCA's contract to provider Child and Family Focus found a need for prevention services with the youth at George W. Hill Correctional Facility. Because they were at the adult facility, they did not have much interaction with the general population, and the prevention specialists were able to go in and conduct several evidence-based programs for these youth. This allowed for socialization as well as a platform to educate young people on the dangers of drug and alcohol misuse and protective factors like goal setting and talking with trusted adults. The SCA's contracted providers, Child Guidance Resource Center, and Child and Family Focus had great success with their evidence-based family programming this year with high attendance at programs like Strong African American Families and Strengthening Families programs. Child Guidance also had around 50 people attend their in-person family game night. This allows for a space for families to receive ATOD prevention and focus on protective factors like family connection and support. And finally, the SCA's contracted prevention providers, Child Guidance Resource Center, Child and Family Focus, and Holcomb Behavioral Health Systems all held reducing stigma events in this fiscal year. And I will pass it over to Alicia.
Intellectual and developmental disabilities accomplishments. Enhance resources and communications within the program to ensure family partners, provider agencies, and partnering agencies receive program updates and the Office of Developmental Programs initiatives, information timely. Supported and engaged in cross-system collaboratives. Team support individuals who are involved in multi-systems. Ensure coordination of care, continuum of services and supports, transition process for individuals aging out of the children's system to the adult services. Supported children with medically complex needs, connected providers in order to live in the community and services and have a meaningful everyday life. Engage with providers to increase program capacity to support individuals with complex medical needs. Address the needs identified by individuals and families through the independence monitoring for quality review process to ensure immediate health and safety. Next slide, please. Increase capacity for our quality management unit to address the number of individuals needing support and building an infrastructure to sustain the growth. Conducted provider risk screening of qualified providers to monitor service delivery, health safety concerns for the individuals that we support. Conducted additional monitorings as needed when health and safety concerns are identified. Increase program capacity by adding new providers to our network and support coordination, in-home and community supports, respite services, residential services, and supported living supports. Successfully supported the transition of individuals in the community from prison, emergency respite, and residential placement, human trafficking crisis situations, 24 hours on-call emergencies, and support teams with end-of-life planning.
For the mental health program, the accomplishments were that we continued to grow the Delco contact program to provide support to families while waiting for service capacities, and families have benefited through this program, which helps to ensure that families do not fall through the cracks and provides warm handoff so that there's someone who's working with those families until there may be a service provider that might be able to provide their service. Coordinated with juvenile justice, juvenile probation, children and youth services, and school districts to implement the multi-system youth pilot with Georgetown University and the Stoneleaf Foundation. We became one of only 4 Pennsylvania counties to secure 4-year system of care grant funding. We operationalized the Mobile Crisis for Law Enforcement program through the Congressional Directive Spending Award to Delaware County. The initiative involves coordination between Human Services, the District Attorney, Emergency Services, and local law enforcement. We implemented a certified peer specialist warm handoff in the emergency rooms. We have the same provider for our certified peer specialists as Drug and Alcohol has for their certified recovery specialists. Many of those individuals are certified in both recovery and in certified peer services. So we all know that people are not, in a vacuum. People have a variety of different needs. And this collaboration between drug and alcohol and mental health with a single provider assists us in having a broader view of what the people's needs are in those emergency rooms. So that's been a very successful program. So I did that, the Pennsylvania counties twice, okay. We commenced an assessment of our crisis services and development of a plan to address the gaps to align with the SAMHSA Crisis Best Practice Toolkit. We worked with Court and Community Connections Administrator and the District Attorney's Office to move forward the Healthy Kids, Healthy Schools initiative. We increased blended case management providers to 5 in order to ensure that all individuals needing a case manager are able to access one in a timely manner. We also have a new provider that focuses primarily on services to children. We have supported the wellness recovery team effort. We've updated the program description to serve 50 clients and improving the overall physical and behavioral health within 6 months timeframe. The wellness recovery team program consists of a certified peer specialist, a behavioral health clinician, and physical health care nurse navigator who's a registered nurse. This program allows individuals who have some medical needs and mental health needs to be able to get those needs met and become more stabilized from a physical health perspective so they can move on to blended case management or other services in the community. We trained 135 individuals, county human service staff, providers, and partners in trauma from July 23rd of 23 to June of 24. We assisted in implementing monthly multi-system meetings for youth with both juvenile probation, child welfare, and to create a whole person plan for youth. We attended 22 community events to provide education on mental health services and overall county services related to social determinants of health. We developed a mobile competency restoration program to allow for competency restoration to happen where the person is, as opposed to in a facility such as Norristown State Hospital or the prison.
So now we're going to talk a little bit about where we see Human Services going as a department in the fiscal year that's going through June of 2025. Next slide, please. That's right. So for Human Services as a whole, we are looking to transition out of civil service. Civil service employees are Human Services, as well as the County Office of Services for the Aging. We also would like to increase our network of providers. We want to do that because we want to make sure if someone comes in to receive services, they should have the same choice that someone who maybe has private insurance receives, and they should be able to make sure they're getting the services they want in the environment they want. And if they're not happy with one provider, there's another one available for them to work with. We also want to do a lot more with data-driven decisions. We want to evaluate our current programs to make sure they're meeting the needs of the residents and doing what they set out to do, and then making decisions as far as contracting, increasing contracting, maybe decreasing contract based on those data points that we're tracking. We also want to continue to enhance the relationship we have with community-based organizations and also increase public awareness. One of the big things that we struggle with is people don't always know about human services until they need the services. When they need the services, they're in crisis, and it's very difficult, even not in crisis, to maneuver through some of the programs, let alone when someone's in crisis and has that additional stress on them. So we'd like to have a situation where people are aware of what we do, they know who to call, they know where to go, and they are fully knowledgeable of the services that are offered. We also want to enhance our current forensic infrastructure for individuals that are in that population, so they don't end up reoffending, they don't end up back incarceration, they get the services they need in the community, and then can lead a life in recovery and wellness. So with that, I will turn it back over to Janet.
Next slide, please. Thank you. For adult family services goals and initiatives, Housing Navigator has been hired to assist programs and the community in locating affordable housing. Funding for HMIS data technician will enable better data oversight and reporting to improve reported outcomes and possible additional funding. This goes right along with what Sandy was just saying around data-driven decisions. Renovation of the Delaware County Share Food Program warehouse is expected to be completed in fall of 2024, increasing the availability of food resources. The SOAR program to assist 20 homeless individuals with obtaining their Social Security benefits more expeditiously. Reduce the number of households who become homeless and reduce the length of time they remain homeless. Transition households from emergency shelter or rapid rehousing to permanent housing when possible. Increase and secure ongoing forensic funding so we can continue to provide bridge funding for housing, food, transportation, ID, clothing, and other social determinants of health, which help to increase community tenure and well-being of those returning to the community from prison or a regional forensic center. And I'll turn it over to Pam.
And for our drug and alcohol goals and initiatives, we will be hosting a 2-week certified recovery specialist training open to Delaware County residents and those who are employed within county limits to expand the workforce in that area. We will support our new recovery house providers and existing contracted ones to coordinate amongst each other and with other stakeholders, and to continue to increase coordination of care to ensure safety and comfort for their residents and to professionalize these services. The SCA, in coordination with the Delaware County Recovery Community Committee, will plan and host an event in September, which is National Recovery Month, to celebrate and recognize individuals living in recovery. This event will serve as a social norming practice. We will continue to promote SCA-funded services in a meaningful way with focus on specialty grant programs such as LEDI, STAR, and tailored prevention events and seminars. We will analyze the 2023 Pennsylvania Youth Survey data regarding behavior, attitudes, and knowledge concerning alcohol, tobacco, other drugs, mental health, and violence with a group of professionals in the field who will meet regularly to discuss areas of the survey to focus on as priorities for our youth in the county. The goal is to meet as a work group to continue analyzing the data and create an agenda for the upcoming PACE Summit, in which we will share the findings with community stakeholders, professionals, school districts, and other interested parties through powerful presentations and keynote speakers. We will support multiple mini grants provided through funding from the SCA for Committee on Prevention and Education programs. These grassroots groups provide alcohol, tobacco, and other drug prevention services or other protective factor activities throughout the fiscal year. This includes safe post-proms, backpack giveaways, and prevention education programs. And we also will continue to support the SCA's Certified Recovery Specialist Warm Handoff programs to serve individuals surviving overdoses and/or those with substance use disorders who present to the physical health system, to increase utilization and to increase the use of medications for opioid use disorder, and to assist in treatment to the physical health care setting, and to increase awareness overall of the presence and the utility of these programs among stakeholders, including the public healthcare systems with physical and drug and alcohol. And I'll pass it to Alicia.
Intellectual and developmental disabilities goals and initiatives will continue to actively participate in the multi-systems cross-collaborative team to review, plan, coordinate levels of care for transitional age youth, homelessness, forensic population, and medically complex children and adults, and individuals with dual diagnosis. Continue to add to program capacity and address individual needs and identify barriers to services. Increase program capacity by participating in the housing voucher program through the Office of Developmental Programs to address housing needs for individuals identified from support coordination agencies that are on emergency PUNS list, the forensics needs, individuals moving from ICS of homelessness prevention, opportunities to live independently in the community. And Delaware County is one of 12 counties participating in this voucher program. We will also continue to share and provide opportunities to discuss the benefits of life sharing and supported living for individuals to live independently in the community. We will continue to foster relationships that support opportunities for individuals to connect with community partners to engage in meaningful day activities, supported in competitive employment, and community participant supports. Continue to explore data related to access and utilization of services as it relates to racial disparities. Provide and educate our providers and communities and individuals on the needs. To support the implementation of the ODP selective contracting process in order to better support the individuals we serve. Provide support to our supports coordination entities in implementing this initiative. To continue to provide education and support individuals, families, and school partners as they transition from the education system to the adult program. Work with our school districts to support smooth transitions from the education system to the adult system. Provide families with resources needed to support their dreams of an everyday life by utilizing the tools from the Life Course framework. Continue to access the effectiveness and the needs of the dual diagnosis treatment team to support individuals living in the community. Continue to build and expand the current infrastructure to meet the challenges of registration due to the increase of individuals looking for services, incident management, waiver supports, fiscal management of federal and state and county funding, and support the needs of the individuals utilizing FSS and ARPA funding. Provide opportunities for families to meet potential providers, agencies, and receive resources and network with families. Work with County Assistance Office to ensure individuals eligible for medical assistance are supported during the renewal process. Thank you.
So the mental health goals and initiatives for the 2024-25 year, to complete the crisis service strategic plan and begin implementing and identifying the goals for that process, to open the transitional youth residential treatment facility and the forensic long-term structured residence. Those are two residences that we have been working very diligently over the last couple of years to secure funding and locations for them, and we hope to have them both opened within the 24-25 year. The relocation of the Marion Trace Community Residential Rehabilitation Service, that program currently has shared bedrooms, and the relocation of this program will allow individuals to have single bedrooms. Even if they have to share apartments, they won't have to share a bedroom, and it will also increase the capacity. Open an on-site crisis center and base service unit in the eastern end of the county. Implement our Hair initiative, which works with our communities of color to raise both prevention, awareness, and the availability of services to assist our county work toward unique programming to equitably address the needs of all community members, to implement the warm handoff and emergency departments, to expand our dual diagnosis team to provide additional support to individuals with both mental health and intellectual and developmental disabilities, gain and maintain community tenure, to develop a forensic rehabilitation center to divert or step down individuals with multiple needs from entering the prison or remaining incarcerated. The Community Residential Housing Program is planning to celebrate our clients who are transitioning to new housing upon completion of their personal skill building and program goals with the annual celebration. The celebration will highlight the individual residents' achievements and be co-planned with the Office of Mental Health as well as the program community residential agencies. Implement monthly team meetings for our highest risk youth individuals, including utilizing support of the high fidelity wrap around and other peer-based services to support youth and family-driven practices. Offer youth mental health first aid, train the trainer to our local school districts to empower each school in the community to provide more important information around mental health wellness for youth. Our fiscal plan for the 24-25 year, it's important to note that while we are encouraging people to provide us with input and suggestions in terms of needs that may be unmet in the community, that the funding for the block grant has been relatively flat for many years. There's been a slight increase over the last couple of years in the governor's budget that's given us a little bit of a bump, but we don't anticipate any large influx of funds, at least through our block grant. So the fiscal impact, the total funds is around $46,567,651, and that supports all categoricals. Next slide, please. The lion's share of the amount of money goes to the mental health program. Most of our residential programs and other programs that are not funded through Health Choices are funded through the block grant. The Intellectual and Developmental Disabilities Program receives almost $8 million. This money is utilized for individuals that are not waiver eligible or do not have Medicaid or in other ways are not able to receive services. So these are funds that we use to pay for services for those individuals. Drug and alcohol is just under $2 million. Again, these are services that are not paid for through any other funds. Homeless assistance is $838,000. And then the Human Service Development Fund is around $500,000. So that is the average breakdown of how we structure the budgets when we send them in with the block grant. However, as Sandy has mentioned a number of times, one of the benefits of being a block grant county is that while these are where we believe that the need will be and where we will be spending most of our funds, if there's a need to shift any of this money for any reason, we have the ability to do that with very little paperwork or approvals. It is really in the control of the county to utilize these funds in the way that we see fit. I'll hand it back to Sandy.
Thank you. So just to reiterate what we said at the beginning, our commitment again is our mission, that we're committed to addressing the social services needs of our county residents in an inclusive and equitable manner with a holistic, trauma-informed, cultural competent, fiscally responsible approach designed to meet the statutory mandates of each of the respective program offices. Before I open it up for questions, I just have a few comments. One is, and I know I say this every year, I'm always amazed when we do this because when you're in the thick of it and going through the day-to-day, you don't realize how much you're really accomplishing. And also just to highlight what Janet says, we're doing this pretty much with the same amount of money we were given in 2012, 2013, which was a 10% cut. When we became a block grant county, all the counties got cut, not just everybody, not just block grant counties. So we're doing this pretty much with the same amount of money with minimal increases over the years. And we're still doing a lot of things for the county. I'd be remiss if I didn't thank our team, the administrators that are here with me today, as well as the staff who on a day-to-day basis are working with the individuals that need services, are connecting them and doing the best they can to make sure those people are connected with whatever services they need. I also want to thank County Council for their support. Their support of our services and our programs are invaluable. With that, I would like to open it up for questions. If anybody in the room has a question or comment, please feel free to step forward to the mic and state your name and the town you live in. I think is what we're asking. All right, seeing none, is there any online comments or questions? No, there's none? All right, well, thank you. Anybody else have any final thoughts in our group? All right, well, thank you, everybody for coming out. Hopefully, you've learned some stuff from this, and we appreciate you supporting what we're doing. Thank you.